Good morning to my dear students and welcome to our social science class. So yesterday we discussed about the healthcare facilities in India, the drawbacks and also the positive points of the healthcare facilities in India. So today we are going to discuss about the story of Hakim Sheikh, and also we will discuss about the differentiation between public health and private health. And so please go through the video, and if there is any doubt, please feel free to ask me. And please read your chapter thoroughly. The points are very important. And thank you. Have a nice day and God bless you.
So here's a small story of Hakim Sheikh. He was a member of Paschim Banga Khet Mazdoor Samiti. So in short form, we can say PBKMS, an organization of agricultural labor in West Bengal. So he was a member of an organization of agricultural laborers in West Bengal. So what happened one evening in 1992? He accidentally fell off a train and had head injury. He suffered from head injuries. So his condition was very serious, and hence he was taken to hospitals. So when he went to the first hospital, he faced a problem of not having a spare bed. Then he went to second hospital. He had a problem of not having specialized doctors, and another he moved to 8 government hospitals where problems were found regarding the either of the hospitality or either unavailability of the doctor or sometimes unavailability of the equipments. And what happened? That is why they had to rush to private hospitals to get treated, and that's why they also had to spend a lot of money because private institution cost a lot of money to treat patient because they are not under any government sector or any government based organization, right? So they charge their own money according to the treatment. Also, that is why he was very angry and upset because beside being there was availability of government hospital, but because of some problems, he was also facing a lot of attitudinal problem from hospitals and the management. So he went to the court along with other members of PBKMS and filed the court in the case. Just my students, now imagine what something if something like that would happen with you, what would you feel, what would you do, and what a judge will actually give a suggestion or advice to a person like Hakim Sheikh. So it was just a story to show you a scenario of the health sector in India, and to show what are the problems faced by the person like Hakim Sheikh. It's not only about one person, but there are many people who come to hospital but they are not getting the treatment and hospitality in a proper manner because of unavailability of specialized doctors sometimes, or maybe sometimes the spaces are less, sometimes there are no equipments. So basically this happens in rural areas mostly, because in urban areas nowadays there are specialized doctors, there are private medical institutions where patients are treated very properly. So this is a scenario, you just imagine and think the problems a person has to face in a time of emergency. So next we will study about the important topic, that is public and private sector of health and the differences among them. So my dear students, let's continue with the main topic, that is public and private healthcare services. From there are two stories already, one I have explained and another you will read by yourself, right? So based on these two events and the two stories, we have come to know there are two type of healthcare services, that is public healthcare services and private healthcare services or facilities, we can say. So first of all, let us know about public healthcare services. What is it? What are the agendas and what is the action for this public healthcare services? So the public service is a chain of health centers and hospitals run by the government. So most important thing is that these hospitals are run by government and not any private owner or any private company. So they are linked together so that they cover both rural and urban areas and also can provide treatment to all kinds of problems from common illness to special services. So here we know a famous hospital, GMCH, that is Guwahati Medical College and Hospital, where it's a specialized and also it's a government based hospital where specialist doctors are there and they provide proper healthcare services to the people and also the patients. And there are some hospitals in the rural areas like Nalbari, we have Komarkuchi. In many areas there are hospitals situated in rural areas and also in urban areas who are run by government. So at the village level there are healthcare centers where there is usually a nurse and a village health workers. So in village level we have a healthcare centers where nurses and village health workers are there, and they deal with common illness and work under the supervision of doctors at primary health center, that is PHE. Please remember this abbreviation, very important. And such a center covers many villages in a rural area. For example, take Nalbari is a area. Out here we have got one healthcare center. So there are many areas under Nalbari, right? So these hospitals or these health centers are taken care of by this bigger one. So at the district level is the district hospital that also supervise all the health centers. So this is like a district hospital who supervise all the health centers located in or out of that area. Large cities have many government hospitals, such as the one where Aman. I didn't discuss the top story about Aman. Please do read and try to uh, think about it and link it. One where Aman was taken, also specialized government hospitals such as one in Hakim story. Alright, so we have come to know that Hakim was also treated in a hospital where specialized doctors were there, right? So the health services is called public. Let us know why it is known as public. There are many reasons for it. First of all, in order to fulfill its commitment for providing healthcare to all citizens, the government has established these hospitals and healthcare centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Uh, I hope you already know about the taxes, income tax that our parents pay for the job they do, right? Income tax is being paid by every individual in the country to maintenance of hospital, basically the government sectors by building roads, building schools, building government hospital, etc. So hence such facilities are meant for everyone. One of the most important aspect is very important aspect of the public health system is that it is meant to provide quality healthcare service either free of cost or at a low cost. So when you visit a government hospital, the cost ultimately gets reduced comparatively to the private hospitals where the cost is very much, and a person who is very poor cannot avail the facilities of a private hospital. Rather they go to government hospital because out there the cost is low, and sometimes it's free of cost also. Another important function of public health is to take action to prevent the spread of disease such as TB, malaria, jaundice, like diarrhea, chikungunya, etc. So this has to be organized by government with the participation of people, otherwise it is not effective. So along with the government, every person, every citizen is responsible for the effectiveness of not spreading all this common illness. For example, when taking up a campaign to see the mosquitoes do not breed in water, coolers, rooftops, etc., this has to be done for all houses in the area. Recall the case of Hakim Sheikh. Would you like to know what the court said in this case? So, let us see what happened with the case of Hakim Sheikh. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities. The government must safeguard the right to life. This is very important, of every person. The court said that the difficulty that Hakim Sheikh had to face could have cost him his life. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situations. Hospitals and medical staff must fulfill their duty of providing the necessary treatment. Hakim Sheikh was denied treatment at various government hospitals. Therefore, the court asked the state government to give the money that is spent on his treatment. So this was the justice which was served to Hakim Sheikh for not providing proper healthcare services at a time of emergency. So you can see uh, what are the actions taken by our state government, or you can say the government hospitals, and you came to know about the primary health centers and also district level health centers and various other health centers which are located in the rural villages. Not only in rural areas but also in urban areas, government hospitals are fully available with proper healthcare services and advanced equipment for treating patients, and also full-fledged and specialist doctors and nurses. For today, let's wind up the topic and we'll continue on Tuesday. Thank you. Have a nice day. God bless you, my dear students, and I'll update the assignment soon.